Very good evening to each and all who is joining the webinar. And today's webinar is conducted by the Killa API. And today's topic is physiotherapy in hemophilia management. And I request all the participants to get updated. Kindly follow all the IAP platforms, digital media team. Myself, Dr. Nagraj here, and without much wasting the time, I'll hand over the session to Hari Krishnan sir. Thank you.
Thank you, sir, on behalf of IAP Kollam district as well as IAP Kerala for helping us organize this webinar. A warm welcome to all of you to the webinar on the role of physiotherapy in hemophilia management, organized by IAP Kollam branch Kerala chapter on this World Hemophilia Day. By the time all our participants and delegates join, we will have a short inaugural session to this webinar. Starting it off right away, let me invite Dr. Rajeevan.
Kindly give instructions.
Yes, sir. Before the webinar, we will give the instruction on like how to ask questions. So first of all, we will have an inaugural session followed by which we will have the session. And during the session, if you are having any questions to be asked, you can send it as messages to the chat box during the session, which will be answered at the end of the session. And at the end, we will have a question answer session wherein you can raise hand and during the discussion time, and you will be unmuted, and then you can raise your question directly. So starting it off with the inaugural session, let me ask Dr. Ajay Ghosh, Secretary IAP Kollam, to give the welcome note.
Thank you so much, sir. With pleasure, I introduce myself. I am Dr. Ajay Ghosh, Secretary, IAP Kollam District, Kerala Chapter. I am giving a brief introduction of IAP Kollam District. I am holding this position as a secretary from last 2 years, and so proud to come to this platform. And also, IAP Kollam is one of the most popular and most iconic district nowadays. Because many events, many occasions, all the programs and most of the events are very popular in many districts and many states. So we are very happy to do the webinar today. Today is World Hemophilia Day. Hemophilia is a rare condition, and many of the on the present serious scenario, many of the working professionals doesn't aware of this condition and how the physiotherapy can help with this condition. So today the discussion is all about the role of physiotherapy in hemophilia management and the general awareness program. On this occasion, I take this opportunity to welcome all the dignitaries. Firstly, I welcome the IAP Central Committee for providing us the wonderful platform for the events. Here I welcome the representative of IAP Central Committee, Dr. Nagraj Maka. I welcome you, sir. And I welcome today's session moderator, Hari M. Co-chairperson, IAP National Branch Coordinator Committee. I welcome you, sir. I take this opportunity to welcome our chief guest for the inauguration, the beloved president of IAP Kerala chapter, Dr. Srejit Ambudri, sir. I welcome you, sir, on this spectacular day. Also, I would like to welcome today's guest of honor, IAP Kerala State Women's Health Coordinator, Dr. Gayathri Krishna. Welcome you, ma'am. And here I welcome the legends of IAP Kerala State Representatives, Dr. Jim Gopalakrishnan, State General Secretary, IAP Kerala. I welcome you, sir. And the Director of IAP Kerala State, Dr. Rajeevan Jayakumar. I welcome you, sir. And Dr. Vinod Raj, sir, IAP Kerala State Vice President. I welcome you, sir. Also, I welcome Dr. Jerry C.P., IAP Kerala State. And I would like to welcome the district office bearers and my dear friends, Dr. Mahesh Kamar, convener IAP Kollam District, Dr. Atul Chandran, treasurer IAP Kollam District, Dr. Vinita, Women's Health Coordinator, IAP Kollam District, and Dr. Ranjit Mishra, Executive Member, and all other IAP district and state IAP members, students, all other delegates. I welcome all of you today. Finally, I welcome the energetic and enthusiastic led and the Women's Cell Joint Coordinator of IAP Kollam District. Today, the resource person, Dr. Gayathri. I welcome you, Dr. Gayathri, on your special day. Wishing you all the very best. And thank you, and wishing you all a very evening and a warm welcome. Now, I welcome the President of IAP Kollam District, Dr. Mahesh MR, to give away the presidential address. Please take the mic.
A very pleasant good evening to all. Honorable dignitaries, respected seniors and fellow members, friends. I feel extremely privileged and honored to given this opportunity to address you all in the World Hemophilia Day. On every year, across the world, observe World Hemophilia Day, acknowledge volunteers who support the hemophilia community and raise awareness about these conditions. The World Federation of Hemophilia is established in 1989. Okay, in the name of Frank Schnabel, April 17th was chosen as a memory of his name only. We IAP Kollam got a proud opportunity to host a webinar on physiotherapy in hemophilia management in the support of IAP Kerala State and Central Committee. Physiotherapy has an important role in hemophilia patients. 80% of the bleed occurs in patients with the hemophilia in musculoskeletal origin. So physiotherapy has a best role in hemophilia. I would like to introduce our speaker, Dr. Gayathri Rajeevan, Joint Coordinator, Women's Cell Kollam Branch, and extend my sincere gratitude to all my colleagues who support, were always more ready to their support in making this event a success. Thank you.
Thank you, Dr. Mahesh, for the presidential address. Now, I would like to invite our most beloved President of IAP Kerala, who doesn't require any special introduction, to give the inaugural speech for this webinar.
Good evening, all. I'm very happy to be before you as the president of IAP Kerala on this day, World Hemophilia Day. I would like to congratulate IAP Kollam branch led by Dr. Mahesh, Dr. Ajay Ghosh, and Dr. Adul Chandran, which is being well coordinated by our national branch co-chairperson Hariam Krishnan for coordinating such a wonderful webinar. And also, I would like to have a special thank to Nagaraj Maka, who was already with us from 7:30 or even for the trial session and is coordinating it very well. And from the part of physiotherapy, we may be thinking that what is the role of hemophilia is a medical condition. What we have as a physiotherapist, what is our role? So many of us doesn't know what a physiotherapist can do in hemophilia. See, there are chances for pain. Pain management is very important. And when you are going for pain management, it should not harm or it should not injure the patient. So there are chances for disability. There are chances for muscle wasting. There are chances for contracture or muscle wasting due to disability or dysfunction. These things can be improved or controlled or effectively managed by physiotherapists. But the thing is, in hemophilia, we should be very careful. We should know everything. What are the complications which can happen due to incorrect physiotherapy? I think today's webinar will enlighten all of us regarding these points, because even with the 30 years of practice, I haven't I have gone through very limited number of hemophilia patients. So it will be an enlightening session for all of us. Without taking much time, I'm happily declare that this webinar is being inaugurated. Hope all will have a wonderful day.
Thank you, sir. And next, I would like to invite our guest of honor, the most vibrant and always charming face of Kerala IAP, Dr. Jayashree Krishna, who always preaches and reflects women empowerment in her career spanning for around 3 decades now, and who is also the state women's cell coordinator for IAP Kerala. Welcome, ma'am, and give a, welcoming you to give an address on this special occasion.
Good evening, all. Thank you, Dr. Harikrishnan, for your complimentary words. And thank you, everyone who joined in this evening. I, Jayashree Krishna, IAP Women's Cell Kerala State Coordinator, would like to extend my special thanks to IAP India and IAP Kerala chapter and all the IAP committee members and also the IAP Women's Cell Kerala and also the organizers of IAP Kollam who put heart and soul in this event. I feel very proud to say that webinars organized by IAP Kerala chapter has chronicled a huge success each time. IAP Kerala organizes such a webinar under the guidance of our state president, Dr. Srijit Nambudri, to promote the participation of all the physios and also the enlightened profession. Let me welcome our guest, most vibrant woman, Dr. Gayathri Rajeevan, who is the co-founder of Rebounds Physio Center and also the joint coordinator of IAP Women's Cell Kollam. She is known for her professional ability, and also I can say that she's a living inspiration to all of us. I would like to extend Dr. Gayathri to come forward to share her views and approaches in this rare topic, especially on World Hemophilia Day on Hemophilia. Thank you, Dr. Gayathri. I wish this webinar enlightens us all and provides us with the knowledge of approaches and the ways to deal with it. As our president said, it's a very rare topic. Even as a senior physiotherapist, all of us must eagerly waiting for the webinar. All of you, please enjoy the webinar and thank you very much. I welcome Dr. Gayathri Rajeevan once again. Welcome, Dr. Gayathri. Thank you.
Thank you. Thank you, madam. Thank you. And next, I would request the most vibrant General Secretary of IAP Kerala, Dr. Jim Gopalakrishnan, to speak few words. Jim, sir.
Thank you, Dr. Hari. Am I audible? I'm so sorry, I'm outside, so some disturbance may be happen. So very good evening to you all, and welcoming all of you to this wonderful webinar. Thank you, IP national leaders and IT sector management, and I take this opportunity to really appreciate the Kollam team for coming up with the vibrant idea to have a webinar on the topic of hemophilia, where every year April 17 is celebrated as Hemophilia Day for encouraging the volunteers and getting up the updates and new things to support the hemophilia patient. As rightly said by our state president, including me, this much of seniority never touched our book to open the hemophilia page and learn what is the role of physiotherapy. But now the updates are coming up like that, and I'm very happy to hear hemophilia physiotherapy does an important role. Or bleeding is a very primary complication in all of the surgery events and all of the injuries. So we deal with injuries, we deal with manipulations, we deal with movements, mobilizations, whatever it may be. We definitely create some injury for some good reasons, and we get good results also. But in a hemophilia patient, while taking care of a hemophilia patients, so we must be very much alert and careful about these injuries where the bleeding can backfire us in a bad manner. So I'm very sure Dr. Gayathri will be showing light on this area, which will be benefiting all our physiotherapy professionals, students, and all seniors in this era. And I'd like to, welcome you all to this wonderful session. And I'm congratulating Gayathri for taking this particular topic. And thank you all, state office bearers, to make this happen. Thank you.
Thank you, sir, for your kind words. And now I would like to request our dear treasurer of IIT Kerala State, Dr. YGP Jayakumar, to speak to us.
Good evening, all.
Yes, sir. Yes, sir. Continue.
Baiju, sir.
Sir, can you please mute the background voice?
Baiju, sir, continue. Or Hari, sir, he can be called later. Let us start.
Yeah, I think sir is having some issues with his background voice. And do we have our state Vice President, Dr. Vinod Raj, sir, over here? Sir, if you are here, can you just please switch on your video? Yeah, I think he is also having some technical issues. So now we will move on to the session without wasting much of our time. And before introducing our faculty, I would just like to remind all our participants, like if you are having any questions in between the session, you can send it as messages to the chat box, and which will be answered at the end of the session. And at the end of the session, if you are having any doubts, like you can raise your hand during the discussion time, and you will be unmuted, and then you can ask your questions directly. So now moving on to the session. And one more thing, even including the panelists, I would request all of you, when the session is going on, other than the speaker, all others, if they could mute, it would be good for the clarity of the session. So now I would like to request Jerry sir, the executive member, to the state executive member from IAP Kollam, to give the faculty introduction.
Yes, sir.
Jerry sir, can you please unmute and yeah.
Sir. Good evening, friends, colleagues, students, and professionals. Good evening, dignitaries. Let me introduce Dr. Gayathri Rajeevan, who has done her graduation from Medical School of Medical Education, MG University, and has done her master's in cardiorespiratory from JDT College of Physiotherapy, affiliated to KUHAS. And she's also the joint coordinator, Women's Cell Kollam, District Committee, IAP, and co-founder and senior specialist physiotherapist of Rebound Physiotherapy and Rehabilitation Center. She has done so many awareness classes in physiotherapy as well as webinars in physiotherapy. And it's a privilege to introduce Dr. Gayathri from Kollam chapter to IAP national team to deliver the discussion regarding hemophilic management in physiotherapy. Thank you.
Over to Dr. Gayathri Rajeevan to start the insightful session on the role of physiotherapy in hemophilia management. Ma'am, please take over.
Thank you, sir. Good evening, all. Today, I would like to thank Kollam IA for organizing such a wonderful session. And I have seen this type of topics are coming as a webinar subject. And and then I would like to thank national and state IAP team for arranging this platform for us. And we can directly move to the session. Okay, we can just directly move to the session without any delay because we have only limited time to because it's a wonderful session. Sorry, it is a big session, so we need some more time. Actually, it's only 1 hour. I wanted to discuss the topic. Okay. So in this session, actually, I'm actually going to see the physiotherapy aspect of hemophilia. The clinical aspect of hemophilia, I am not explaining this much that much on this session because you will be already knowing about the clinical aspects. So we can move the session. Hemophilia is one of the major bleeding disorder. You may be in all the clinical features and clinical aspects of hemophilia well. And it is a disorder causing very large amount of bleeding and lesion. Even a small cut of injury can cause large amount of bleeding. This due to the deficiency of some factors, coagulation factor in the blood. You may be knowing the coagulation process of blood. You will be studied in your physiology text and some of the factors are necessary for coagulating blood. But in hemophilia patients, it is deficient and it can cause the the coagulation process will be more longer. So that is what is happening in hemophilia. This you people will be knowing all these things, and it actually is X-linked trait, and usually male population is affected. And there are three type of hemophilia. There. One is hemophilia A, hemophilia B, and hemophilia C. Usually, the hemophilia A and B are much common than hemophilia C. And there is another type called acute hemophilia. In hemophilia it is called as partial or stage hemophilia. And usually the factor 8 is affected. You may be knowing the importance of factor 8 in the coagulation process of blood. And the factor 8 is affected here. And it is an X-linked trait. Usually male population is affected. In case of acquired hemophilia, you may not be familiar with the term acquired hemophilia. Hemophilia is usually genetical disorder. But there is another term called acquired hemophilia. Means if patients have some type of autoimmune disorder that can ultimately result in deficiency of some of the clotting factors and that can ultimately result in hemophilia. It is called acquired hemophilia. Usually this acquired hemophilia will show the classical features of hemophilia A, and then there is another type called the classical hemophilia that is also known as Christmas hemophilia. You may be familiar with this type of hemophilia because it is also known as royal disease. It is also affected mostly in males, and there is another type called hemophilia C. I am speeding up these all these clinical features because you may be already knowing all this. I am explaining this for just for an introduction speech. Okay, you may be familiar with carrying effect or the hereditary factors of hemophilia. And next we can move to the manifestations of hemophilia. This is something important for physiotherapy aspect. So when we are into the hemophilia manifestation, mouth bleeding is one of the common symptoms in hemophilia. If the patient is doing something hard or patient is brushing or dental extraction processes will cause much bleeding in patient and will be nose bleeding and there will be some unstoppable hemorrhage after a small injury or cut. There will be some urine or blood will be mixed with blood. The patient will notice the presence of blood in the urine or stool. Usually, some patient may be having caution, and that time they may be using more stress during defecation. That can ultimately result in blood in stool or blood in urine. And hematoma, you may be familiar with the term hematoma. And what is important in the physiotherapy aspect is the last two symptoms that are joint bleeding and muscle bleeding. That I will explain later about the detailed aspect of joint and muscle bleeding. Just first see what are the clinical aspects of hemophilia. Then just we should look into the severity of hemophilia. In physiotherapy, as before you are giving to physiotherapy to any of the hemophilia patient, you should understand which category your hemophilia patient is included. Because according to severity level, we need to adjust our treatment. Okay. So in normal patient, you give any type of treatment, you may be already knowing that. Then in mild hemophilia, your presence of factor in your blood will be up to percentage to 50%. In that case also, you can give any exercise or any modality, but you should be monitoring the patient closely because patient have chance of bleeding. Okay. Then in moderate case of hemophilia, the presence of factor will be 1% to 5%. So in that case also in give exercise, but you should be very closely monitoring the patient. And in case of severe hemophilia, you should give some rest in between sessions, and you should give the intensity of the exercise should be very minimized, and some of the exercise must be avoided for patient. According to you, you should change your treatment plan according to the severity level of the hemophilia. So it is very important while considering the physiotherapy aspect. And next is medical management. Only one medical management is available for hemophilia. Usually, the patient is treatment with replacement therapy. That means you will be externally supplying the flow factor to the patient. So, it is the main medication that is given to the patient. For applying the replacement therapy, there are two methods. One is preventive therapy or prophylactic therapy, and other one is demand therapy. Preventive or prophylactic therapy means the patient will be receiving the replacement therapy throughout their life. For on-demand therapy, the patient will be receiving the replacement therapy once the patient is required or it is necessary. That means your floating factor will be very less to a very low amount. Below something, there is some category for this demand therapy. So you people actually don't need to study all this. Actually, in our aspect, what is important means we should understand which treatment method the patient is following. Okay. If the patient is doing prophylaxis therapy means the patient have high chance to angle bleed. That means even if patient is receiving replacement therapy, that doesn't mean patient is not having any episodes of joint bleed. Patient is highly susceptible for joint bleed even if the patient is receiving therapy. Okay. So if the patient is receiving prophylaxis therapy means patient angle joint will be the common site for joint bleed. So when you are giving exercise to this patient, must be very careful that the patient will have angle bleed. So you should be when giving angle exercise, you should be very careful with the patient with this undergoing the prophylaxis therapy. But when it is coming to the on-demand therapy, you should be very careful in knee joint because high chance of knee joint bleed is there in this therapy management. So when you are giving exercise to the knee joint, you must be very careful if the patient is taking on therapy treatment. And also in prophylaxis therapy, the episodes of trauma will be much common than bleeding. But in on-demand therapy treatment, the trauma will be very less and the chance of will be more. So you must be very careful when dealing with this patient, and you must understand what are the severity and what are the treatment the patient is undergoing. Okay, these two factors you should understand before starting physiotherapy treatment. Next, we can move to the physiotherapy session of hemophilia. Actually, when you
Ma'am,
already seen the
excuse me.
replacement therapy, hello.
Excuse me, ma'am.
Sir.
Sorry to interrupt. Like, if you could adjust the mic, no, because there is a vibration coming in between, so it would be.
Okay, sir. Okay.
Please come near to the laptop, ma'am. Near to laptop you can speak, so we can avoid it.
Okay, sir. Okay, am I audible, sir?
Yes,
Yes,
ma'am. Now we
yes.
can hear it.
Okay. In physical therapy session, actually you see in the medical management system of hemophilia. In this system, actually, we are giving replacement therapy to sustain patient's life. But what physiotherapy doing means we are improving the quality of life. That is importance of physiotherapy in managing hemophilia patients. Actually, many medical systems are organizing our role. So that's why National Hemophilia Foundation formed a physiotherapy working group for giving a best physiotherapy tips for these patients with bleeding disorder. So this is what is we are doing. We are improving the quality of life of these patients. Okay. Then we have four roles in managing hemophilia. One, we are reducing the bleeding episodes. Next thing, we are preventing the complications. And third thing, we are improving the quality of life in chronic complications. And fourth thing, we are rehabilitating the patient with severe complications of hemophilia. And our main aim is to prevent the arthropathy or hemophilic arthropathy is there. That is one of the very serious issues in hemophilia patients. So that is our main function, that is to reduce the incidence of arthropathy. Then how another question usually people ask is how can we differentiate the muscle bleeding with these other muscular conditions? Okay, and we are giving exercise to a patient in your department. Usually, patient will tell pain because pain is one of the common feature when we are with common symptoms. One of patient will tell you when you are giving physiotherapy to these patients. Okay, so can we differentiate the arthropathic pain or other musculoskeletal pain with the bleeding pain? If patient is telling you like a sensation of fullness or stiffness or discomfort, then there is a chance of slight bleeding in hemophilia patient. And usually this slight bleeding will be very difficult to identify, and it is very difficult to distinguish from arthritic pain. So, in case of mild bleeding, you should give the patient some rest, and you should be closely monitor the patient. Okay. In moderate bleeding, it's very easy to identify because patient may be having some swelling, and there will be a movement restriction at the end range, and there will be pain during the movement or even rest. Okay. In severe bleeding, the pain will be very severe, and it will be accompanied by a marked swelling, and also there will be complete restriction of movement in this patient. Okay, so these are the main symptoms in him bleeding issues. So you can monitor these symptoms and ask identify the patient's bleeding episodes. Right, okay. Then next we are going to the evidence-based approach. I'm actually explaining many of the treatment modalities here. So most of the techniques, or all these techniques are actually based on the current evidence. So I am mentioning some of the evidences here. Actually, I already told you physiotherapy will prevent the recurrent bleeding episodes. Actually, I have given two articles that actually tells physiotherapy prevents recurrent bleeding episodes. Okay, then I have also already shown one article here that shown actually proprioception function improving in patients if we are giving proprioceptive training, and it is very important in other patients. So it will improve the quality of life. That's what this article is saying. And these two articles, one is actually showing the joint deterioration in hemophilia actually improved well in if we are giving continuous physiotherapy and proprioceptive exercises. And these two articles actually shows the frequency of hemarthrosis is decreased in knee joint due to physiotherapy. And these all are the evidence I collected for your enlightenment. Okay. Then, before going for physiotherapy, we should understand the thing that in this hemophilia patient. Okay, first is risk of anemia. Actually, uh, patient may be having some risk of anemia because patient is having current episodes of bleeding that cause ultimately the anemia. So you may be knowing the anemia is one of the generalized contraindication for physiotherapy. So you must be restricted patient from exercising and mobilization. Uh, go through the section. Okay. Okay. We must before what I'm trying to tell you is that before going for physiotherapy, we should understand what are the complications of hemophilia patient. So we should act according to. Okay. Then first risk is risk of anemia. Actually, patient will be having many episodes of bleeding, so that ultimately result to anemia. So you may be knowing that this anemia is one of the generalized contraindication for physiotherapy and exercise. So when patient is having anemia means you should restrict the patient from exercising or mobilizing. And the next thing is risk of bleeding, that you may be already knowing this. And third thing is lack of joint proprioception. Actually, due to recurrent episodes of bleeding, the patient will be having some arthritic changes in the joint. So, because of this, patient proprioception will be lacking. That you may be knowing that proprioception is actually the function of joint, and the joint synovial membrane and the cartilage and all the muscles are doing proprioceptive function. So, due to these arthritic changes, the patient may be having lack of proprioception. So, when you are giving the exercise or any balance training or coordination training, you must be very careful that patient is having proprioception, lack of proprioception. So when the patient is lacking proprioception means he is having high risk of injury or high risk of balance issue. So you must be very careful when dealing with this patient. And third thing is dehydration. This patient may have high risk of dehydration. So you should be maintaining the proper hydration level to this patient. These all are the things you should remember while treating a hemophilia patient. And then next we can move to the physiotherapy in hemophilia, other conditions wise physiotherapy management. Okay. First, we can go to the direct complications of bleeding. That is, one is muscle bleeding, another one is joint bleeding. First one is muscle bleeding, another one is joint bleeding. In muscle bleeding, actually, the muscle may react to bleeding. When bleeding is happening to certain muscle means the muscle will undergo certain reactions. And in some muscles will be having tightening reaction, and some muscle will be having weakening reaction. If the muscle undergo bleeding is flexor group of muscle, then that usually shows tightening reaction. And if a patient, if a muscle is having, if a extensor muscle is having bleed, that means there will show weakening reactions, or there will be show some weakness in the muscle. So these are the muscle reaction to bleeding. And the main common muscles having bleeding episodes are forearm flexors, biceps brachii, iliopsoas, quadriceps, and hamstrings. And among these muscles, we can categorize the muscle bleeding into two categories. One is muscle bleed inside the iliopsoas muscle, and other is a muscle bleeding except iliopsoas muscle. Okay. First, we can see the muscle bleeding except the iliopsoas muscle. And then in acute phase of this muscle bleeding, we will be restricting the patient from all the activity, and we will be giving some splinting, and we will be doing the RICE protocol. I think you may be familiar with the RICE protocol, and you can give TENS if the patient is having your patient is complaining about pain, and the TENS is one of the safest modality when it's coming to the electrotherapy system. So we can give TENS as a pain relieving method. And in subacute stage, we will be giving some isometric exercise. Here also in acute stage or subacute stage, we are not giving in weight bearing exercise. That is actually very important in this whole program. And we will be giving splinting in this stage also. We will be giving some positioning, free range of motion exercises, and we will be also giving TENS if patient is complaining of pain. And in chronic stage only, we are promoting full weight bearing. Otherwise, we are not giving any full weight bearing exercises. And we will be giving positional stretches. Other stages, we are not promoting any stretching exercise. But here we are giving some stretching exercise. And we are giving active range of motion exercise here. And we will be reevaluating patient again and again for any further bleeding. So we must be taken some precaution before going for physiotherapy treatment. That is, neurovascular compromise should be monitored before giving splinting, and we should be testing if there any compression on affected muscle. It should be avoided. Usually, we won't give heating modalities like ultrasound or dry heat to this patient, but sometimes you may use ultrasound as a blood absorption for blood absorption. So that time you must be very cautious with these heating modalities. Then we can directly move to the iliopsoas muscle bleeding. Actually, why I am giving more importance to iliopsoas muscle means iliopsoas is one of the major muscle in the body. It is a large muscle, and it is receiving one of the major blood supply. So whenever iliopsoas muscle is bleeding means patient is highly susceptible for death, or patient mortality rate is very high in case of the iliopsoas muscle bleed. So Whenever patient is having ileoceas bleeding, you must be very careful and you must monitor femoral nerve palsy in these cases because I already told you the flexor muscle will undergo the contracture or tightness mechanism. So ileoceas will undergo tightening reflex and it may cause the femoral nerve palsy. You may be knowing the entire anatomy of these things and femoral nerve palsy may be common. So you must be monitoring the femoral nerve palsy. And the bleeding in iliopsoas muscle may not be easily recognizable because it is a deep muscle. And the symptoms may be like pain in the thigh, hip, groin, or abdomen region. And patient may be unable to stand or lie flat, and hip will be always in flexion. That means iliopsoas is a hip flexor, and it will show tightness in the iliopsoas muscle will cause in the flexion of the hip joint. And there will be inability of walk, and patient may show some like patient may be toe walking usually, and the patient may be having numbness and sensations, numbness and tingling sensation along the thighs. And these all are the symptoms what ileoceas bleed is showing. And you should be clearly should restrict the patient doing XLR. This is important in ileoceas bleeding because I will show you how the ileoceas work during contraction. Okay. When the ileoceas is contracting, the line of the muscle actually working like this. So it will induce more compression on the spinal segment. So it can ultimately result to some nerve palsy, or it can result to some disc bulge, or like that issue will be happening. So you must be restricting the patient from doing SLR because in ileoceas bleed, the muscle will be already in contracted position. So you are giving more contraction means patient will be having more issues on the spinal disc or the femoral nerve. So you must be very careful while giving XLR, and you should teach the patient backyard technique because the patient is having. I already told you the ileoceasis contracting means the patient is highly susceptible for disc issues. So you should advise the patient backyard techniques, and you should always monitor the spinal nerve root for any compression, and you should initiate the treatment approaches according to. Then in acute phase, we will be giving bed rest because I already told you the psoas muscle bleed is very dangerous. So you must be given patient bed rest, and meanwhile should give some exercise to the opposite limb. And the weight bearing should be restricted. And if patient want household mobility, you can ask the patient for thought touch weight bearing walk. Okay. In subacute phase also, we will give some isometric exercise and active range of motion exercise. But here also, we are not promoting any type of weight bearing. And we should be very careful while doing this exercise. And we could given some positioning and for this patient. And we should exercise more on the non-involved limb. In chronic state, we can give full weight bearing and we can give active range of motion exercises. And the next is psoas and sacroiliac joint. Actually, this psoas muscle is actually a hip flexor. It has origin point at the spine, and it is having insertion point on the hip joint and the ilium. So when these 2 points are fixed and the psoas major is on contracted position, that means it will induce a boosting effect on the in the ilium or the SI joint. So it can ultimately result to sacroiliac dysfunction. If the patient with hemophilia having tight iliopsoas muscle and he is weight bearing and just turning around or just descending the stair means patient have highly susceptible for this sacroiliac dysfunction. So you should be very closely monitoring this patient if the patient is telling back pain for this sacroiliac dysfunction. Next, how we can check the sacroiliac joint dysfunction. Actually, ask the patient. There are two methods for testing the SI joint dysfunction. One is standing forward bend test, and another is sitting forward bend test. Actually, sitting forward bend test is more preferable in case of hemophilia patient. And this is how we are doing the standing forward bend test is doing. Ask the patient to bend forward, and meanwhile we should place our thumb on the PSIS and ask the movement of PSIS while patient is forward flexing. If the patient is normal, both the thumb will be moving equally. So patient will be normal or patient is not having any sacroiliac dysfunction. If the patient is having dysfunction means one joint or the affected joint will move more upwardly. So this is how we find out the sacroiliac joint dysfunction. The sitting position also we can do this exercise. Actually, sitting position is more preferable. Then next is joint bleeding. Usually, some of the joints have more highly susceptible for joint bleed, and these joints are called target joints. Usually, knee, ankle, elbow are the common site of injury, and this hip and shoulder joint is also having uh, some hip and shoulder joint is also having bleeding episodes. But among this, knee, ankle, and elbow joints having common episodes of bleeding. This is because these joints, because two reasons. One is these joints are hinge joints. You maybe already know that the hinge joint having 1 degree of freedom. So due to this, the patient may be having bleeding on these joints. And second thing, hinge joint usually have less muscle support. When we are considering the shoulder or hip joint, it is having a high muscle support. But when it is coming to the knee joint or ankle joint, the muscle support is very less. So patient is having high episodes of bleeding in this knee joint and ankle joint. Okay. Then these are the common joints affected in with joint bleeding in hemophilia patient. And next, we should not be more aggressive in case of joint bleeding, and we should always monitor the nerve compression. And already I explained the heat modalities are not given in these patients. And while giving ultrasound, you should be very cautious. And in acute stage, we will be doing the same protocol as I told you earlier. We should be giving rice protocol, or we should be giving splinting. Here also, we are not giving any weight bearing. We can give partial weight bearing with assistive device. And we can in subacute state we can give rice protocol, and night resting splint should be given. And we can give progressive weight bearing in subacute state itself. And we should give some gentle active range of motion exercise if patient in pain free range. And we can give pain free progressive strengthening also. In chronic stages, we can give the exercise, proprioceptive exercise. Actually, in joint bleeding cases, actually in chronic stage, the proprioceptive training is more important considering the other techniques. So you should include the proprioceptive training in the joint bleeding cases. And the next thing is postural consideration in bleeding disorder. Actually, there may be some postural changes in these patients, because I already told you the joint bleeding can cause some deformity, and the muscle bleeding itself can result some contractures and weakness. Ultimately, it will result some postural changes. And there may be common postural changes includes like flexion deformity will be in elbow, knee, and hip. And there may be hyper or lumbar lordosis will be more, or exaggerated lumbar lordosis will be there. It is due to actually the iliopsoas muscle bleeding. And plantar flexion in the ankles is common, and it may be due to the bleeding inside the calf muscle. And the pelvic asymmetry is common. I already explained the SI joint dysfunction and all these things. Actually, the pelvic asymmetry can be due to the sacroiliac joint dysfunction, and the limbal length discrepancy will be there, and it will also result the pelvic asymmetry. The limbal length discrepancy is usually due to the muscle tightness, and there may be flexed wrist and fingers. It may be caused to the contraction in the deep forearm muscles. And you should consider which all these deformities are happening in patient, and you should understand which muscle is affected. But because in hemophilia patient, you can do the MMT, all these muscle assessment techniques, because you can't use high resistance to this patient. So you must observe the patient, and you must observe the posture of the patient, and you can identify the muscle weakness. Okay. Then next, this is one of the this is one of the table I got from internet. This is actually says which all are the deformities occurring in joint bleeds. In knee joint bleeds, actually flexion deformity is occurring. In elbow joint bleed, actually it is also causing flexion deformity. In hip joint, it causes flexion and external rotation deformity. And in the cause flexion, this is already I mentioned earlier. And in knee joint, in muscle bleed, you may be already knowing this, because I already explained the flexor group of muscle usually show contraction, and the extensor group of muscle usually shows weakness. So you can find out which all are the muscle is affected based upon the position of the joint. Okay. Then next we are going to hemophilic arthropathy. Apart from all these muscle bleed and joint bleed, what is important for physiotherapy aspect is hemophilic arthropathy. Actually, after many episodes of muscle bleed, the patient may develop some type of arthritic changes. Around 50% of patients with hemophilia actually develop this arthropathy. Apart from other type of arthropathies, usually young population is affected more. Usually children and adolescents are affected more in case of hemophilia arthropathy. So main symptoms are like the symptoms will be more like osteoarthritis, and symptoms will be pain, swelling, and temperature variations. There may be swellings also, and the patient may be having pain during getting up from the chair, and during stair climbing also patient may tell pain, and joint deformities will be there. And based upon the disease progression, we can categorize this disorder into three categories. One is acute hemarthrosis, another one is chronic synovitis, another one is degenerative arthritis. In acute arthrosis, when joint bleeding is occurring to the patient's joint, bleeding is occurring to the patient's joint, that means it can damage the cartilage itself, and it will cause some synovitis, and basic arthritic changes may be happening in the joint. This is called acute hemarthrosis, because this presence of blood inside the joint will cause, you may be knowing that the blood have high content of iron, and this iron and the presence of blood can cause damage this cartilage in the joint, so it can result in arthropathy. This is actually the stage acute hemarthrosis. And next stage is synovitis. In synovitis, you know that you already know that the synovium having high content of macrophages and the barrier tissue. So usually an inflammation is happening means my macrophages inside the synovial will be getting activated. In synovitis, when the blood is present inside the joint means the synovial will be inflamed, and it will be getting some inflammatory reactions, and the synovial ultimately get into damage. So that results synovitis. The synovitis is commonly seen in rheumatoid arthritis. So this stage the patient will be showing symptoms like rheumatoid arthritis. So next stage is degenerative arthritis. In this stage, due to all the previously explained mechanics, and also you may be knowing that the articular cartilage doesn't have any direct blood supply. They actually get nutrients uh, from the synovial fluid. If the synovial fluid is having more amount of blood, means the proper nutrition won't be getting to the cartilage. So the cartilage will ultimately go for damage, and all these previously explained pathomechanics can result in the degenerative arthritis. So, due to all these things, the joint undergo degenerative changes, and the symptoms will be more like osteoarthritis. Like previous session, I told you that the synovitis stage will be like rheumatoid arthritis. Here it is like osteoarthritis. So, hemarthrosis, what is important means both the symptoms of RA and OA are showing this patient. So, usually affected population will be children and adolescents, and patient will be showing the symptoms of OA and RA. Okay. Okay. Next, we can see some imaging studies here. The imaging study is important in case of hemarthropathy because it will be different from other arthropathy. If you see this X-ray image, you can see the condyles are actually very flattened, or the joint surface is very low, and the condyles are flattened at the surface. And you will see the intercondylar groove is much more deeper than the normal structure. And if you see in the lateral view, the patella, you see the patella, inferior angle of the patella is more squared than its normal shape. So it is actually seen in knee joint hemarthrosis. And if it is when it is coming to the elbow joint arthritis, you can see the radial head is more enlarged and the joint space is reduced. When it's coming to the knee joint arthritis, there is one classification called Arnold-Hilliard classification, and there is a four or five categories based upon this. You can refer this from textbooks because this is not important to physiotherapy aspect. So this is all our clinical aspects. So you can see, you can refer this from internet or textbooks. Then in angle joint, if we are looking for angle joint, MRI will be more preferable than X-ray because in angle joint there will be some muscle imbalance, and the growth imbalance will be there. So in case of ankle joint, you can prefer MRI than that X-ray technique. In MRI study, is much more better than X-ray when it is in case of early arthrosis, because in early arthrosis we can see the synovial changes and the joint bleed, everything we can see in the MRI study. So MRI will be better than X-ray when considering the joint bleed in acute stage. Then we can use other nuclear medicines also. And ligament laxity. Ligament laxity is another complication of joint bleed. When the joint is bleeding, it can stress the joint capsules and ligament. It can ultimately lead to joint instability. And this can be one of the major complications of hemarthrosis. And it can be seen in very light bleeding also. So when we are giving exercise to this patient, you must understand the patient is having ligament laxity. So when giving exercise, you must be very careful or extra careful that patient is having high chance of injury. So this must be considered when you are giving exercise to this patient, especially resisted exercise program. You should consider the episodes of ligament laxity, or you should check the patient's ligament before giving any exercise. Then next is we are going to look at the total knee arthroplasty in hemophilia. Actually, total knee replace arthroplasty. Some of the physios and the practitioners are thinking that surgery is contraindicated in hemophilia patient. No, nothing like that actually. Because if the factor or blood coagulation factor is 4% also, we can do knee arthroplasty. Usually, hemophilia A patients are undergoing knee arthroplasty. Actually, recent evidence or surveys showing the patient is hemophilia A patients are going for this knee arthroplasty. Apart from other arthroplasties, the patient category will be young age group. That means children and adolescents will be the population undergoing knee arthroplasty. And during the rehabilitation, what we are going to see is when giving exercise, we should consider the patient is having high risk of anemia and joint bleeding. So we must be very cautious on this area. And immediately after surgery, we won't be giving any weight bearing. Up to 6 weeks, we will be avoiding patient from full weight bearing. And you know that after any surgery, there is high risk of deep vein thrombosis and pulmonary embolism. But in case of hemophilia, the bleeding risk is more risk. Bleeding is having greater risk than comparing to the DVT or pulmonary embolism risk. That doesn't mean that the patient doesn't have DVT or fatal pulmonary embolism in hemophilia. Patient may also have chance to have deep vein thrombosis, but risk of bleeding is greater when comparing to this. So in medically, they can't give any anticoagulants to this patient because patient is having bleeding disorder. So that time, the ball is on our court because we are preventing the deep vein thrombosis. We will be giving intermittent pneumatic compression. We will be giving some exercises like active range of motion exercise. We will be giving. So we can give isometric exercise to this patient, and we should be advising patient some exercises to prevent deep vein thrombosis according to the patient condition. And we should be already told you we should be asking the patient not to weight bearing on the affected limb, and we will be ambulating the patient as soon as possible. With not with full weight bearing, we will be giving partial weight bearing, and we will be ambulating the patient as soon as possible to prevent the episodes of deep vein thrombosis. Okay. Then this is one of the X-ray image I got from internet for patient done arthroplasty after the bleeding episode. Then this view will be familiar that a cerebral hemorrhage, because a patient is having high risk of bleeding. So there is high chance of cerebral hemorrhage. The rehabilitation will be same as we follow, but we should be very careful. That's all. In hemophilia patient, you should be careful. And up to if a patient is having cerebral hemorrhage in hemophilia, up to 72 hours, we won't be giving any exercise. And even in ICU, we are not giving any passive movements also. Because patient is having higher risk of bleeding, joint bleeding. So we are not giving an exercise. We should be 72 hours. We should monitor the patient. Then next is gait analysis. Actually, I already mentioned some of the postural defects in hemophilia. Due to this postural defect, there will be some gait deviation. Usually, the patient will be showing increase in stance space and increase in double support duration. And patient gait will be very slow. And patient will be showing some andalgic gait also. Many of the patients are showing the toe walking pattern. And You should identify which pattern your patient is doing. Again, gait analysis should be done in hemophilia. And I have shown one article. Actually, this article shows the gait deviations in hemophilia. And next is how can we manage in hemophilia with physiotherapy technique? We can see the modalities and treatment techniques in detail. First one, we can directly look at the pain management, because pain management is one of the important aspects in physiotherapy. And to improve patients' quality of life, pain management is a must do thing. So in acute cases of joint bleed or chronic pain, joint bleed can result acute pain, and the chronic pain can be due to arthritis. So we must understand what is the reason for patient's pain, and we should act the we should give the treatment according to the patient need. Okay, then usually, aquatic therapy is one of the major treatment of choice in managing pain, and we can give some active range of motion exercise. Usually, we are preferring active range of motion exercises because resisted exercise can result joint bleeding in certain patients. So we must be very careful while giving resistance exercise. We can do active range of motion exercise in these patients, and we can use electrotherapy methods also. Low frequency TENS is very effective in this patient. I already told you, TENS is one of the common choice of treatment in case of hemophilia, because when comparing to the other modalities, TENS is having very less side effect in this patient. So actually TENS is very effective, and we are using more commonly TENS is using. There are other modalities also. We can use iontophoresis with the local anesthesia, and we can use NMES also. Dynamic current is usually a preferred choice, but it can cause minute bleeding episodes. So, and the medium frequency current can be used, like IFT can be used to reduce edema and hematoma. But in all these other techniques, like iontophoresis and medium frequency current and dynamic current, will induce muscle contractions that can be lead to muscle bleeding. That way, I prefer more the TENS when comparing to other modalities. Then ultrasound therapy. Usually, we people won't give these heat modalities to this patient, but in some countries they are giving ultrasound to reduce the bleeding episodes or reduce the inflammations and the additions. And some of them are using this ultrasound for absorbing the blood, and we can use phonophorus also. But actually, it is a heat modality, so it can cause bleeding. So actually, it is better to avoid ultrasound, but if it is necessary, then you should be very cautious while giving ultrasound therapy. Next is thermotherapy. Actually, ice is preferred, cryotherapy is preferred in hemophilia patients. Heat therapy is not that much indicated in hemophilia because it can cause bleeding. But one of the major side effects of cryotherapy will reduce the uh, activity of platelet and this bleeding coagulation factor. So it can ultimately result to some bleeding issues. So only 15 to 20 minutes of cryotherapy is recommended on this patient, and 2 hours interval, 2 hour rest interval in between should be given to this patient. And heat therapy is usually we are not giving, but if the patient is necessary to give heat, you can give heat, but you must be very cautious while giving heat. Usually, it is not preferred in the case of hemophilia. And when giving electrotherapy, you must be aware of the general contraindications of electrotherapy, because the patients here are children and adolescents. So you must be very cautious that you not apply anything on the epiphyseal plate, because it ultimately results in pain. So you must be taking all these risks, or you must be considering all these risks. And next thing is we can use biofeedback methods and relaxation techniques you can use, and the PNF you can use. Actually, these relaxation techniques are very important, and mental training is very important, because the pain in hemophilia is may not be always due to the hemophilia complications. Maybe psychological issue will be there, psychosomatic disorders will be there, because hemophilia is one of the chronic disorder. So patient will be having some psychosomatic issue that can ultimately result to pain. So mental relaxation is very important in case of hemophilia. So you should be considering that also. Then next thing is price technique. I think you may be familiar with the price technique. I already mentioned many times about price technique in joint bleeding and muscle bleeding section. I think I explained the price technique. According to the National Hemophilia Federation, now they are revised the price technique into police technique. Police means they are replaced the rust into O and there. That means optimal loading. That means optimal loading means optimal exercise. Actually, it means optimal exercise. You can give isometric exercises or active assisted exercise or active exercises. That is actually indicated as optimal loading. And apart from rest, optimal loading is important in this patient. So other than using price technique, you can use the optimal loading technique or police technique to this patient. And next thing is, how can we prescribe exercise in hemophilia? Actually, before prescribing exercise, we should consider many factors and we should be remembering the contraindications and complications of hemophilia. And some of the important points I will be mentioning here. Okay. First thing, some of the physios are thinking if the patient is having deficiency of clotting factor, then patient will be restricted from exercise. It is not like that. I already told you, if the patient is having 4% of the clotting factor itself, we are giving even surgeries also. So we can give exercise. Actually, the deficiency of factor doesn't mean that the patient is should be completely restricted from exercise. We can give exercise, but we should be very careful. We should be remembering all the history. We should be taking the medical history of the patient, and we should be giving the exercise according to the patient history. And while doing exercise, we should be slow and steady, because we should start the exercise very slowly when isometric exercises are preferred first, and we can progress to gradually progress to resisted exercise. And we can always start isometric exercise, because due to the risk of bleeding, isometric exercise is more preferred as a starting exercise. And other thing, there will be pain always. Okay. Usually, physiotherapy, some of the exercise may cause pain. If you are giving a patient if you are giving exercise to some patient, usually the patient will tell pain first or 2 days. The DOMS will be there. So in hemophilia also there will be pain. That may not be always necessarily that arthritic pain or bleeding pain. So you must be very cautious when patient is telling pain. But pain is usually a common part of rehab. It's a part of rehabilitation. You should understand that also. Then each situation is unique, because the exercise we are giving will be different for each people. That you may be already knowing in physiotherapy. We are actually individualized exercise program will be giving to the patient. So here also, when patient is coming to you, the exercise will be changing, or it will be unique, or it will be changed according to the individual. Then okay, I have already told you, first we can begin the isometric exercise, and after progressing, we can give the assisted exercise or active assisted exercise. Then you can go for active exercise. Before starting the resisted exercise, you can use the gravity assisted exercise as a start, because it will be much more safer to prevent joint bleeding. Then while giving immobilization, or while giving orthosis, or while giving splinting, you should consider the other joints also. I already told you, when we are giving immobilization to the psoas muscle bleed, we will be exercising the opposite limb. So you must be considering the other joints. Then you must be remember the functional requirements of the patient. So you should act according to, and you should be giving the functional training to this patient. And you should be giving proprioceptive exercise. I already told you the proprioceptive function will be affected. So the proprioceptive function is very important to prevent the recurrent injury. I think I already mentioned one article in previous session. So the proprioceptive function should be very important in these cases. So you must be giving proprioceptive exercise as a part of rehabilitation. Not in case of hemophilia, even after total knee replacement or ligament transplantation, everything you can ligament reconstruction, you can give this proprioceptive exercise. It is a necessary part of rehabilitation, and you should give importance to the patient's everyday activities too. And the exercise should be modified according to this patient's need. Then exercising with inhibitors. Actually, people may not be aware of these inhibitors. Actually, when I already told you, if the patient is having hemophilia, means we will be giving some anticoagulants. Sorry, if patient is having hemophilia, means we will be giving replacement therapy. If a patient is taking replacement therapy for many years or long time, patient will the some of the negative impact will be happening inside patient's blood, and there will be some immune response against these factors, externally applied factors. So we will be giving some inhibitors to this patient, and while giving inhibitors, the patient will be having more fatigue, and patient will be very difficult of doing exercise. Patient will feel very tired while doing exercise. So they may not be cooperating with us. So we must educate the patient about all these things, and we should do exercise. So if a patient taking inhibitors and you must understand the patient will have highly susceptible for fatigue. So while a patient is coming to you with who is taking inhibitors, so you must be reducing the intensity according to the patient level. It is a very important for the patient to continue in the exercise program. And next is aquatic exercise. Aquatic exercise is an ideal exercise for hemophilia patient, because when we are doing water exercises, actually the stress on the joint will be reduced. So patient will be having less chance of muscle bleed, and it will induce some relaxation also, and it will improve the patient's range of motion. So aquatic exercise is preferable in hemophilia patient, and many aquatic exercise programs we already know. Among these, Badraga's technique is one of the effective methods, because it is actually PNF technique inside water. It is actually doing proprioceptive training and strengthening training. So we can use that for pain relief and improving proprioceptive function. Then there is a Aichi method we can use actually. Aichi is for relaxation and pain relief, and we can use Watsu also. Watsu actually for relaxation and pain relief, and patient will get a mental relief from Watsu. Actually, only Badraga's technique is giving some medical treatment. We can use medical purpose. Baki Aichi and Watsu are giving relaxation technique or mental relaxation technique. And while doing aquatic exercise, we should reduce the risk of infection, and we should avoid vigorous exercises. And while giving water exercise, we should consider two factors. One is relative density and one is buoyancy. Usually the relative density of water is 1. And if some objects with relative density of water is greater than 1, it has a tendency to sink. And if a relative density of some object is less than 1, that means the object will have a tendency to float. That you may be already knowing, and the human body is having a relative density of 0.97. And if you are giving more rings and that balloons to this patient, then you can reduce the relative density. While giving exercise to this patient, you must the relative density of the patient should be reduced by using the floating equipment. And in case of buoyancy, there are 3 types of exercise in relation with the buoyancy. Actually, buoyancy is like our gravity only. It is there is buoyancy assisted exercise, there is buoyancy resisted exercise, and buoyancy supported exercise. While giving exercise, you can use buoyancy assisted exercise first. Then you can use the buoyancy supported exercise. That means same like our gravity eliminated exercises, and then you can do the buoyancy resisted exercise. If a patient is standing inside the water and his limb is moving towards the surface, means it is buoyancy assisted exercise. If a patient's limb is moving towards the body or away from the water surface, that means patient is doing a buoyancy resisted exercise. So you can do the exercise according to the patient condition, and you can progress the exercise according to this buoyancy. Then you can use kinesiotaping also. Actually, kinesiotaping you can use for facilitate the myofascial release, and you can use it for increasing the reabsorption and lymphedema. Okay, many articles are available on this technique, but even though I didn't find any relevant article on this technique, but even though the many articles are showing this, but it doesn't have any research value. That way, I am not stressing on this point. Next is proprioceptive training. I already told you the patient will be having some proprioceptive issues. So it is very important to include proprioceptive exercises in your rehabilitation program. You can use PNF techniques and anything. Okay. Next thing, you can use TENS. I already told you TENS is a very effective technique, and these 2 articles are supporting the use of TENS. And next is orthotic management. For preventing the post-surgical deformities and to eliminate pain and correct contraction, you can use the orthotic also. And that's all for today. Thank you.
Thank you, Gayathri ma'am, for the detailed and informative session. And I think if time permits, you would yeah, you would be having more and more details to explain. But anyway, you have given a insight into the usage of various aspects of physiotherapy in the management of hemophilia. And now to the participants, if you're having any questions, you can put it in the chat box, or you can raise your hand so that our central digital team would open up to your questions. Ma'am, one of the questions which has come up is in the chat box. It is what are the PNF technique that can be used, and will MFR be useful?
We can use actually much more resistance used techniques are not preferred in hemophilia patient because patient is having high risk of bleeding. But you can use these techniques according to the patient's severity level. I already told you. We first understand what is the severity level of patient. If patient is having a severe level of hemophilia, that means you can't use this PNF technique. But in mild or moderate hemophilia, you can use any techniques. But when coming to the moderate level of hemophilia, you can use with the mild resistance exercise like hold, relax, contract, relax, all these techniques you can use. But while giving this, you must be very cautious. That's the only thing. But you can use in hemophilia there is no such separate techniques. You can use all techniques, but when giving these techniques, you must be very cautious. That's all.
Okay, another question, I mean, another point that came up in the chat box was whether could you just give an explanation regarding the last slide? And I think a similar question related to that was also like the proprioceptive exercises that could help.
Okay, last slide was based on the orthotic management. Actually, I already explained that we will give some orthotics or splints during the acute phase of or subacute phase of muscle bleeding or joint bleeding. So orthotics actually used for actually the slide is saying the same thing. Actually, it can be used for reducing muscle contracture and it can be used for reducing pain. Actually, I think orthotics are already we studied in our degree classes. So that is the only thing I explained. In case of proprioceptive training, actually the patient may be lacking proprioception in this patient. Okay, so due to the muscle bleed, so we must be giving some exercise like weight bearing exercise, and we can use the slope walking, and we can use the trampoline. We can use in a mild amount, and we can use the bubble board also, and we can improve the proprioceptive training exercises are there. We can use that balance training and the Swiss ball exercise is there. We can use all these things, but in when you are doing this exercise, you must be very careful because patient is having lack of proprioception, high chance of fall and injuries there. So you must be very cautious, and the area should be arranged according to that. That's all.
Okay, another question which came up was like, are massage techniques useful in hemophilia?
Uh, Okay, massage technique you can give. I don't know why you are giving preferring massage technique. Actually, via myofascial release, if it is myofascial release, it is okay. But I don't know what is the effectiveness of massage technique in physiotherapy. Actually, we are not doing in massage therapy or massage techniques currently. Myofascial release you can use in more mild or moderate level of patients. In severe hemophilia, we are not using any techniques like this.
Okay, ma'am, another question is, can we proceed with the normal exercise protocol for TKR patients with hemophilia? And what will be the weight bearing status?
Okay, if patient is only after only one of two things we should consider. We can use the normal exercises according to the patient's condition. We can modify the. I already told you we will be using the individualized exercise program in these patients. And while giving exercise, we should consider one or two points like we should be giving weight bearing only after 6 weeks, and we will be giving the mainly up to this 6 weeks. We will be considering the deep vein thrombosis, and we will be trying to prevent the issues of deep vein thrombosis. So that is the only thing you should consider. You can use the normal protocols by giving the exercise. If patient is telling pain or patient is having signs of joint bleeding, you must be very careful. That's all.
Okay, ma'am. Another question is, what about using dry needling for treating musculoskeletal injury to the patients with history of hemophilia, like if there is no active bleeding?
Actually, I researched this on, I searched many articles about this, but I didn't find any relevant articles regarding this. Actually, now our physiotherapy is improving or improving day by day. So we are actually doing evidence-based practice. So based upon this, I didn't find any relevant article based upon this effectiveness of my this dry needling, all these things. But if a patient is requiring dry needling, you can use. There is no contraindication for doing dry needling, but the effectiveness, it is a question still. You can search if there is if it is indicated, you can use. There is no contraindication.
Yeah, to the participants, actually, if you're having any questions, you can also raise your hands so that our central digital team, they will give access for you to ask questions directly. And the session which madam has presented over here, it is basically, framed based on articles or RCTs or systemic reviews, which substantiate the things that she told. So if you are having any more questions, you can raise your hands or you can ask directly. Okay.
Hello. Am I
Another
audible?
question.
Hello. Hello. Hello.
Yes, sir. Yes, sir.
Good evening. Good evening, Doctor Gayathri.
Sir.
First of all, I congratulate you for taking a valuable information to our professional team. It was very nice, wonderful. Okay.
Thank you, sir.
Hello.
Thank you.
I had a small doubt. Okay. I can tell you, Frank, that till today, during my clinical practice, I didn't come across with any hemophilia patients, but I had one experience. So long back, one patient came to me with one prescription chart. In that chart, it was written like that. That condition diagnosed as uh, von Willebrand disease. Von Willebrand disease. And in the bracket, that hematologist mentioned that you can give same protocol as whatever the things we are giving in the hemophilia. Actually, it was a first experience for me. So I sent that patient to, in Alue, government sector, we having a beautiful rehab center is there for hemophilia patients. I think they're having all the facilities, all the medications are free, everything. The government of Kerala is connected that center, connected to that Alua hospital. So anyway, sent to that patient to that center. But when I searched that condition, I got two kinds of opinion. From one source, I got that it is a type of hemophilia, this von Willebrand disease. But in some other sources, I got it that it is entirely different from hemophilia. In hemophilia, mainly the condition is affecting the males. But in von Willebrand, it is affecting the females. And in hemophilia, the bleeding centers are mainly the joints, like elbow, hip, knee, like that. But in von Willebrand, other than joints, intestine, in ladies, vaginal bleeding, etc., is happening. But I don't know much about that condition. If you're having anything, kindly share. I think many of the doctors are also don't know about this condition. This was a very strange experience with me because so I think many of you never will go such a condition like that, see that condition like that. I don't know anybody having the experience before or with this kind of. So just as a doubt, I am sharing. That's all.
Okay. Sir, actually, hemophilia is actually due to the deficiency of protein factors. I think there is a miscellaneous category. Usually, hemophilia affects, as you told, like hemophilia affects males only. But there is another category called the hemophilia C. In that type, actually, males and females are both affected. In that case, it actually is a miscellaneous classification. Maybe this condition may be coming under this category, I think. And I don't think, in this your question you ask, you tell like the protocol will be same like the hemophilia, like that you told. But actually in physiotherapy there is no, we are not stick on to any protocol, because in physiotherapy we have a universal freedom. We can use any exercises according to the patient's need, or we can change the exercise according to the patient need. But there is no such thing like protocols in hemophilia. We can use exercises and techniques according to the patient's disability level or limitation level. And that is what I want to tell. I think this condition will be within the category of hemophilia C. Actually, it is a miscellaneous category.
Actually, that patient was not a Keralite. He came from Bombay. So some hematologist from Bombay only written that description. So anyway, I sent that patient to the Alves. That's right. Now only I recollect that. That's why I asked. Okay. Thank you. Thank you so much.
Okay, sir.
Arun sir, there is a request in the chat box to mention that name in the chat box so that others can also refer to that condition. So if Arun sir could.
Its condition. Yes. Its condition is von Willebrand disease. VWD. So that's a short form. Von Willebrand. It is a kind. It is also a bleeding condition similar to hemophilia. It is also due to low level of the protein. This thing, protein. Already doctor mentioned here. I don't know much about that condition because it's also my first experience. That's why I shared here. Okay. Von Willebrand disease.
Okay, sir. Thank you, sir. And we are running short of time, and if anybody, if you are having any more doubts to share, ma'am, can you share your mail ID in the chat box so that they can mail you the doubts and as well as discuss with you regarding the same?
Okay, sir. Okay, sir. I will share my mail ID.
Ma'am, can you hear, ma'am?
Okay, tell me.
Okay. So you have already told that the TTR protocol is will start weight bearing after 6 weeks only. So, hello? Ma'am, can you hear?
I can hear. I can hear you.
Yes, sir. Please carry on.
I am sharing my experience. Usually we have met with many TTR patients. So what we are doing, I am working in Amrita Hospital. So recently I have a 30-year-old boy with bilateral total knee replacement. Here the protocol is same for that usual TTR. What we are doing is they are giving the factor like thrice daily for at least 4 days initially, then BD, then they'll taper the factor level. But we are moving with the same protocol. So I have already seen patient, but nothing happened. No bleeding. We can directly come to exercise, and also we are doing cryotherapy in between. And CPM machine also is very effective in early stages. For 1 week, I have given CPM, and we have attained almost 90-degree range also. So I think so we can start yearly weight bearing also if patient is getting sufficient factor. It's like that. I think it's updated like that only. Ma'am, that's your opinion.
Okay. Actually, if a patient is having mild or moderate hemophilia, if mild hemophilia patient is having, you can give exercise or you can give weight bearing. You can start weight bearing early. Okay, but this is actually the TKR in case of severe hemophilia. You can start. Actually, it is only a protocol. You can modify the protocol according to the patient's condition. Actually, this is what I told. There is no such a thing like a protocol. To eliminate risk, we are giving some protocols. Actually, it is actually the protocol given by the World Federation of Hemophilia, and in the protocol, they are telling like you should give a weight bearing within by 6 weeks. Okay, this is to eliminate the risk of the patient, and actually it is we can modify the protocol according to the patient's factor level. If the patient is having severe type of hemophilia and factor is very less, then you should be weight the patient even more than 6 weeks. You should be waiting. So that is what I am trying to say here.
Okay, ma'am. Actually, we are running short of time, and actually, it was an 1 hour session. Now we have passed actually 1.5 hour sessions. So maybe the participants, if they are having any doubt, they can mail the details. And now, I mean, mail the doubt and get the details from madam. And now I would request Dr. Adul Chandran, Treasurer, IAP Kollam District Committee, to give the vote of thanks.
Good evening, everybody. I hope all of you enjoyed this class and got a little knowledge about hemophilia. It's a very tough topic, and I try to congratulate Dr. Gayathri to select this topic and had a very good, very nice presentation. And it's a very compact presentation. I know everybody have a lot of doubts on that. Even I have a lot of doubts on that. So we can, if it's possible, we can arrange another session which we can elaborate more. And thank you everyone who participated in this session. And a very big thanks to the state committee, especially Dr. Srijit Nambudiri and Dr. Hari Krishnan, who spend their lot of personal times and their lot of hard work in conducting these things. And I thank Dr. Jari, Dr. Ajay Ghosh, Dr. Mahesh, and Dr. Vinod, Dr. Baiju, Dr. Jayashree, Dr. Jim, everybody who ever come and participated in these things. All the participants, thank you so much for your presence, and we'll continue our sessions like this. And again, we are expecting your presence. Thank you so much. Have a good night.
A special thanks to Nagaraj Makar, who has helped us from the Central Digital Committee with the session. Thanks a lot, sir.
Thank you,
I'm
sir.
very
Thank
sorry,
you,
sir. I'm very sorry, sir. In the hurry, I forgot about you. I'm very much thankful to you. That technical support what you've given is a remarkable thing. A lot of things, issues happened, and the presence of mind helped us a lot. Thank you so much, sir. Thank you.
Thank you, sir. Thank you. All well, welcome. We'll end the session, sir. Thank you. Thank you all.
Yes, sir.
Thank you.
Thank you.
Thank you all. Thank you, Dr. Hari Krishnan, for moderating.